But anyway, they brought in this dude, and we just went in the DR one by one, and he had his table, and he's like, lie on the table, and he racked them and cracked them. And I was like, damn, I felt like 3 inches taller when I got out. Yeah, it was awesome.
Like this knee should be all as possible.
Then it pulls the shoulder up is the problem. You want to step on this knee and step on that shoulder? Just kidding.
You have a scar right here. What happened?
Where? Here?
Right here, yeah.
Skin cancer.
Is that skin cancer?
Yeah, in here.
So these little 2 marks here?
Well, this was actually big. This one got sewn up, but this on the anterior shin, it's very difficult to, because there's not a lot of skin to work with.
Right there, and they dug that deep.
Yep,
huh?
so they just took that out, but this one we closed.
Which one was the first one you saw?
About the same time.
And you went, ugh.
This is the one that I had on my leg, and I was dating this girl, and she's like, what is that? And I was like, I had nothing, don't worry about it. And I didn't know what it was.
You didn't know what it was?
I was like going to work every day, and I was like, I wonder what this is. Heroes for gold. Can you tell the... Wait a minute, have I? Of course.
For skin cancer?
Oh, well, there's having sun-induced skin cancer in African American population is exceedingly rare. Other dermatological conditions are more prevalent in African Americans. Sarcoidosis, dermatosis papulosis nigra, like in planus.
Eczema, or what's that?
Atopic dermatitis or eczema I see all the time. That's more in little kids. There's not a racial predilection for that.
Really?
It's uniform across the board. But no, I have never seen a sun-induced skin cancer in African American person. But I see really bad psoriasis.
Really?
Like in planus.
What does that, I mean, was there a cause for that, or it just happened?
Psoriasis is, there's definitely a genetic predisposition. In some cases with psoriasis, there's a, how can I put it? There is, it's definitely exacerbated by stress. Emotional component to it, and then also occasionally there's an infectious component. Like sometimes if someone has strep throat, they'll develop psoriasis. So it's difficult to treat because it's multi-etiological, many different causes.
Do you feel, what's the percentage of people coming to see you for health purposes or cosmetic purposes?
My office is about 50-50. I see probably 60-40 general, 40% cosmetic. Some of the doctors do more or some do less, just based on their patient population.
Yeah. My oldest daughter, she has real bad acne. And I'm in HMO. And I've gone in there and basically begged for accutane, and they just won't give it to her.
Well, what about generic Soriatane? What HMO is she in? Kaiser Permanente? I'll take care of it. We'll put her on generic. We'll put her on generic accutane. The problem is it's very rigorous the way it has to be done now. You have to use the iPledge system.
Right. But they put her in tetracycline.
Yeah. Did it help her now? I don't love it. Tetracycline is archaic. Kaiser Permanente is...
I don't think she took the medication like she was
You have to take it at least 6 to 8 weeks.
Right.
And tetracycline, was she taking it 3 times a day, 2 times a day?
I think it was 3 times a day.
I mean, one of my problems with teenagers is really getting them to use the stuff appropriately.
The medication.
You have to use it 6 to 8 weeks as a minimum. The reason is the skin cycle takes 57 days, give or take 10 days.
Right.
So you have to have at least that amount of time for the skin cell to come up and be renewed. But Kaiser Permanente is notorious for, like, I see so many Kaiser patients who come to our office. We take regular insurance, we take, out of pocket.
Right.
And I see so many people who don't go to Kaiser.
It was just to the point I had to, like, beg for a dermatologist. And then when we finally got her, they're like, okay. And they wouldn't put her on anything. Right. They gave her some topical stuff.
Their hands are tied. Like, they can't do a lot of stuff.
It's ridiculous.
But I'll take care of that. We'll register in the iPledge system. She has to have, it's a federal mandated program. She has to have a negative pregnancy test. Then she has to wait 30 days. Then she has to see, the problem is she has to see us every 30 days. And then and it has to be registered in a national database.
Really?
What happens with accutane is that it's teratogenic, and women of childbearing age who get pregnant on it, the babies can have severe birth defects.
I understand.
Which, although it rarely happens, it does happen. One time in the last year, I've seen one lady who she was pregnant on accutane, and because I don't know how she bypassed the system. Somehow she bypassed the system, and she terminated the pregnancy.
It was that bad?
Well, no one knows. My recommendation is that you follow the Accutane guidelines strictly, and that's what my office does. They didn't start until last March, and this occurred before last March.
How about nursing mothers? Does Accutane affect nursing mothers?
Absolutely. Cannot do it. Yeah, it's category X, which means it's never been tested, cannot be used. It is teratogenic.
Interesting.
After stopping it for 90 days, you're fine. But it is actually probably my favorite medication but it has to be used appropriately.
Right.
Very severe very strong medication.
Well, Diane, she had real bad acne, and she said the same thing. She said, "I killed my liver." I'm like, what?
No. Not at all. I mean, we take a blood test, but.
Right.
But I know I have kids who come in.
Doesn't make sense. I mean, we have so many medication. Kids don't.
I tell you, we have the technology these days that you will not, in our generation, you will not see people with scarring from acne like you used to see, if they get Accutane on time early.
On time. And my daughter, it's frustrating because, we're on Kaiser, and I'm just like, give her this, and she's going through, wearing her hair down like this. It's sad, Well,
it's also, kids are stigmatized because of, acne is a psychosocial issue.
Totally. I had real bad acne, too. But I went on tetracycline and Retin-A, and that kind of just helped me.
Well, at the clinic where I work, 2 days a week at the indigent patient clinic, they can never get Accutane or anything like that. And tetracycline is exceedingly inexpensive, and generic Retin-A is exceedingly inexpensive, and it's a good way to do it. I have Kaiser insurance.
Oh, you do?
Yeah.
Yeah.
Because I use it just catastrophic. I've never been once. I use it because I don't, I can't get insurance. I don't want to pay for really bad insurance, really expensive insurance. But if my appendix explodes, I want to be able to go and get the operation and not have to pay $1 billion. So I have Kaiser, but I've never used it even once.
Yeah, I don't mind. I'm probably one of the people, I actually love Kaiser.
Some people I have people who love it, and I have so many patients who tell me they hate it, and that's why they come see us.
Well, for dermatology, because it didn't used to be that way. Like when I was younger, basically you can call dermatology and get an appointment. Well, Kaiser has changed so much that you need to see your primary care physician, like a PPO, basically. And you have to see a primary care physician. They have to refer, or like allergies too. Like you got to see this person, see that. And I remember but when I was, younger, Kaiser was perfect because I was a vegetarian. I saw a nutritionist.
That's awesome.
I mean, it was great. I mean, I had both of my kids at Kaiser. I had no problem. I registered for $5, and I had popped the baby out, and I went home.
Gotta like it.
Loved it. You know what I'm saying? And they were great. No complaints whatsoever. But now it's just like.
Kaiser's been having some problems lately. They had a liver transplant program, and it got shut down by the state in California because they were doing they were messing a lot of stuff up. So it's really, healthcare has a lot of issues.
One thing about Kaiser, the thing is, people's like, I don't like Kaiser because they have horrible doctors and everything. And my thing is, what I did when I moved from city to city, I would go make an appointment, and then when I'm leaving my appointment, I would talk with the receptionist. I'm like, so who's the best doctor here?
They know.
And they know. And
Trust
they
me.
would tell me. And they said, but they're not accepting any patients. And then I would call and make an appointment. They go, is this your doctor? I always go, yes.
Yep.
And then next thing you know, I got an appointment.
Smart.
And I'm set. You know what I'm saying?
That's like people always come to the office where I work, and they're like, What?
Don't pour that out. Are you mad?
You left that outside with ants crawling all over.
Was ants in it?
Eat the ants and drink that.
No.
We don't have a lot of...
No, was ants in it?
Yeah, there is.
Oh, no, you can throw it away.
But I told you this before, but it's when people are like, I had to wait for 45 minutes, and I say, listen, if you go somewhere and it is not crowded, there is a reason for that. And we try to book it as best we can. Sometimes we have emergencies. If you have an emergency, I'm going to spend the time with you that you need, and I'm not going to walk out of the room. And you have to understand that. And I said, but I will tell you, if you like, the girls up front will print out a list of local doctors you can see.